Welcome to the Floyd Memorial Library podcast, where we sit down with the people who give shape, texture, and voice to life on the North Fork of Long Island. Some are rooted here by generations, others arrived by chance or choice, but all carry with them a piece of the story. We talk about what's changing, what's worth holding on to, and the currents of history, both quiet and loud, that run through this place. I'm your host, Christopher Bianchi. For episode 132, we sit down with Mimi Fahs, Professor Emeritus at the CUNY Graduate School of Public Health and Health Policy, a nationally recognized health economist and a passionate advocate for improving healthcare systems. Mimi shares how her upbringing shaped her lifelong commitment to public service, her groundbreaking work on Medicare's cancer prevention benefits, and her leadership as a founding director of the Health Policy Center at the New School. Now a full-time resident of the North Fork, she's continued that spirit of service through her involvement with the North Fork Audubon Society and the Oysterponds Historical Society. She's also founded the Mudflats, a local string band that celebrates community through music. In this conversation, Mimi reflects on how health policy has evolved over the decades and closes by sharing her hopes for the future of the North Fork. So I hope you enjoy episode 132 with Mimi Fahs. This episode was recorded May 6, 2025. Thank you so much for coming on the Floyd Memorial Library podcast today. It's great to have you on today.
It's wonderful to be here. My pleasure. Thank you for inviting me.
Absolutely. So just in the beginning, I usually like to ask people if they could share a little maybe introduction about themselves, where they were born and raised.
Sure. I always like to mention that because people are so surprised, but I was born in Rio de Janeiro, Brazil. And I have lots of pictures of myself as a baby being wheeled along the Copacabana beach, which I think may have influenced my love of the sea. I lived in, my father was a diplomat. I lived in Rio, but I was just a baby. And then Chile, Santiago, and Bogota, Colombia, before we moved to the United States when I was 6. So I was bilingual as a little kid. I would translate for my mom at the markets, but back then it was considered problematic to speak one language at home and one out in the world with a child. So I lost my Spanish, sadly.
Oh.
But my father was a big Francophile and spoke fluent Spanish and French and Portuguese. So I grew up in a house that was interested in international affairs. And his family and my family's been here since the mid-1800s, and from the German part of Switzerland. And my last name, Fahs, apparently means political cynic. And my mother's family was more from Ireland and Scotland.
Okay. And I don't know if you could say a little bit about even what your parents did or what you did. Sure. Even when you were in South America.
Well, my mother was an English teacher, a high school English teacher in Annapolis before she met my father. And my father was a French professor and at the Annapolis Naval Academy. And then it was during the World War II, and he had to sail off and was commissioned to teach the Navy Portuguese because we were trying to keep Portugal neutral. So he had the job of taking Portuguese officers to New York and showing them a good time. So it was pretty nice war work. But in Rio itself, that led to him joining the diplomatic service. So he was a diplomat in Rio and Santiago and Bogota.
Wow. And do you remember your time growing up there before moving to the U.S.?
I do. Not Rio, sadly. I just love the photos I see. But definitely Chile. I could see the Andes in the distance, snow-covered, beautiful mountains. I remember our helper, Louisa, who I just adored. And she was a native Brazilian, Chilean from the mountains, a very kind woman. And I remember being astonished and really in awe that she showed me. We spent a lot of time in the kitchen together. My mother had my little sister to take care of upstairs, and Louisa showed me she could eat fire. So it was it was a little bit unusual. But yeah, those are the kinds of childhood memories.
Mm-hmm. And then, where did you grow up back in the U.S. later on?
Well, we moved to Washington, D.C., and briefly, and then my father got a job at the Kellogg Foundation in Battle Creek, Michigan. Okay. And that's really where I grew up. I think we mean when we say grow up, where we went to high school, and that's where I was.
Okay. And so even going through school, I guess it could be more so into middle school and high school, but how was your experience through school, and what were you interested in even in high school?
Well, it was interested in mostly in getting out of Battle Creek and getting out east. Every year we would travel to the east. My mother's relatives were in Philadelphia, and we would go to Nantucket, and I just loved the east. We would go to New York and see shows and just get into the energy of the city. So being in Battle Creek, I really felt a little bit closed in. The Midwest was really not for me.
Yes.
But I loved reading and just I tried very hard to get good grades because I knew to get out I had to get into a good college.
And then so coming out of high school, did you have a clear idea of what you wanted to do as a career path?
No, I did not. No, my father was involved with the Kellogg Foundation and traveled to South America quite a bit, interviewing residents, medical residents, to come for a year of advanced training in the U.S. So I was exposed to this medical field, and I did have an interest. I remember I won a first prize on a map that he helped me get lots of matchbooks from all over South America and to show the different countries of South America. And I did a project in early on as probably an elementary school student or maybe early junior high on kwashiorkor, a childhood disease of malnutrition in South America. And I saw pictures of it, and I think that influenced me actually quite a bit heading towards my career. But something else that also interested me, I remember in junior year in high school, was beauty and the theories of beauty and what is beauty and why is it beautiful. I did an essay on that with my English teacher. Those are the kind of the main memories I have of pre-college studies. And
did you ended up moving to the East Coast for college?
Yes. Well, I went to college in Virginia.
Okay.
So that was the beginning of travels throughout the East Coast. Yeah.
And then when did you make your way to New York? Did that come later?
Yes, that did. I after college, I did live in New York for a short time. And then I went back to graduate school, back to Michigan, but a very different place than Battle Creek, to Ann Arbor, Michigan, which is just a thriving, exciting intellectual community and fun. And I became a big-time Michigan football fan, still am. There that's where I went to the School of Public Health. That's where I started. I realized once I graduated from college, I didn't know quite what to do, but I wanted to make the world a better place, and the School of Public Health offered an opportunity to get a master's in maternal and child health, which I did. And then the professors actually recruited me to go on to the doctoral program. And in the doctoral program, I taught as a teaching assistant a physician from New York, actually from Mount Sinai Medical Center. And then once I finished my doctoral work, he recruited me to come be a health economist at Mount Sinai Medical Center.
What time frame was that? Like, was that in the...
That was in 83.
83, okay.
Yeah. And I spent 13 years as a health economist at Mount Sinai. And it was just a marvelous, exciting time to be a healthcare professional.
Yes. And I don't know if you could touch on just even your thoughts on New York City at that time and what you thought of the area. Obviously, it's changed.
Yes, so many. I mean, it's constantly changing,
it's constantly
isn't it?
Changing, yeah.
Oh, well, when I moved to New York City in 83, that was pretty tough times. Mm-hmm. The crack epidemic was wild, out of control, and the AIDS epidemic was just starting. So there were just a number of challenges. And yet, so for a public health interest, those were very, the field was very alive of trying to combat these issues, these problems. And at the same time, New York City was just absolutely alive with art and music. Mm-hmm. And Soho had not become a place that sold soaps and shoes and fashion. It was full of artists living in some of the old industrial buildings and just performing and presenting fabulous new ideas for art. It was very much fun to be there.
Mm-hmm. And you became a founding director of the Health Policy Center at the New School. That came later, but could you talk about some of the initiatives that you had going there through, like you pioneered several groundbreaking initiatives at that time?
Yes, well, with colleagues, we really tried to address some of the public health challenges that the preventable disease. I'm all about prevention. And one was with a physician that was one of my students, actually, when I was teaching at Mount Sinai, who noticed when she was practicing that women were showing up with cervical cancer at higher rates than it should be, and at that time. There's so many biases, but one was an ageism bias, and screening for cervical cancer was recommended by the leading medical groups, including NIH, to stop screening at 65. And yet she was seeing these 65-year-old and plus women with cervical cancer, which is a completely preventable disease. No one should ever die of cervical cancer. And yet she was seeing that happen. So together we did a small study, published it in the Journal of American Medical Association, that showed a higher rate than was expected, and decided to tackle why are our guidelines saying to stop screening at 65. Well, when we looked into it, the research that these guidelines were based on was all from Europe. And Europe has a completely different health system than we do. And people are screened annually, free of charge, basically. Preventive care is really readily available. They have a health insurance system that is, universal. Everybody has health insurance, so they can get the care they need. Our system, of course, is not like that. And so these women that she was seeing were mostly working women that did not have health insurance. They were, and so for them to get screened, but they probably had not been to a doctor since they delivered a child. And to get screened, they would have to take time off from work. So they were not getting screened. So it was a very different population. And once we sorted that out and published it both in the Journal of American Medical Association and other places, and the guidelines changed.
And was that a challenge just because you went to school for that health public policy, but just trying to explain this to other people that might not even be in the field and getting them to understand these challenges? Was that took some effort to get people to understand this can be prevented?
Absolutely. And that's my training in public health was in health economics.
Okay.
It was so I did it for that reason, that I thought that the economic numbers can be persuasive. And we showed that it would actually save money to screen these women before they had advanced cervical cancer. So that can be persuasive. And then I think the other part of your question is how do you persuade the population and the providers to do this? Well, that woke us up, that it was not just a public policy, health economic issue, because providers, were not, even though it was the right thing to do, they had to be reimbursed for it. So we had to fight for Medicare funding for this. And we were very proud that our screening benefit was the first screening benefit that Medicare paid for. We beat out, and this was a time when people were just beginning to realize there's such a thing as healthy aging, and we don't have to give up at 65. Breast cancer screening was on the table as well, but we beat out breast cancer screening because that particular bill got involved in an omnibus budget reconciliation act. So ours, cervical cancer screening benefit, was the first preventive screening benefit of Medicare. And that almost these days seems amazing, but back then, prevention said, why prevent? They're already old. Their life is over. What's there to prevent? And so, yes, it was an exciting time in a way that we were waking up to the opportunities, not just the challenges, but the opportunities of healthy aging.
Yes. And as you mentioned, even Medicare cancer prevention benefit was groundbreaking, and that challenge to get faced in getting that passed as well. But you said that even people, I guess there was a different mindset back then for the aging population, but just getting insurance companies to move forward with these policies to help the aging population, and maybe people were starting to live longer than even going previously. But it seems like that was a transition at that time.
I think it was. I think you're absolutely right. It's good to pinpoint it in that decade. At Mount Sinai, we recruited the leader at National Institutes of Health who instituted the first National Institute of Aging, and he came to Mount Sinai to start the first Department of Geriatrics. And he recruited me to be, so I had a joint appointment in his department. But I think that you're absolutely right that healthy aging was a new idea, really, so there was a lot of work and interest in how do we grow this field.
Yes. And then, as we've discussed, you've spent time researching older populations, the health of older populations, immigrants with the health disparity. What have you found to be some of the most effective community-based strategies for improving outcomes of these groups?
Well, you have to involve the community. It cannot be top down.
Yes.
That's for sure. And I think that their goals are shared. High quality, accessibility, affordability, reduce barriers to care. And you have to work with the community of what are the barriers. They're different in different communities. Some can be language barriers, some can be time barriers. And how can we work around these barriers to make the programs reachable and get the community involved in that?
Mm-hmm. And also just working in this field of policy makers and health experts, I guess over that time, even from the 80s, coming to even what you might observe today, what do you think are the most critical issues in public health today?
Well, that's a big question because we're definitely in a different era right now.
Yes.
I mean, I think I have two main issues that come to mind, and one is we need to address the social determinants of health, and that's actually a very interesting and challenging way to think about health. Beyond germ theory, what are really the social determinants of our health? And, and that, of course, includes environmental health, occupational health, what is making us healthy in this world we live in today and what is making us unhealthy. And to do that well is to respect evidence. And that's my biggest concern right now is how we are attacking, how the federal government is attacking the science and the scientists, as well as the scientific basis for establishing effective programs that improve outcomes. And evidence-based medicine, evidence-based public health, that was a word that was big back when I was in the 80s when these fields were growing. And it was very exciting because there's so much we can do. And we really need to support our younger scientists growing in the field and in public health and in medicine and in science if we're going to combat and keep improving the lifespan and improving the quality of life within the lifespan. It has to be evidence-based, and we have to support the evidence, the growth of the science that creates the evidence.
Mm-hmm. And like you said, we have seen an attack on the science in general, and whether there's other conspiracy theories or just people getting their information. There's more information out there in the world today, whether on YouTube or other sites where people will come up with different information, but I think it is a challenge today, whether you're dealing with the federal government today or just talking with people and them hearing different opinions on things that were basically already fact-based, whether it's on vaccines or other things like that. It's a tough thing moving forward with how we might handle that. Well,
I think you got your finger on the big issue. Who do we believe? Where do we find our information? And I think the evidence-based information is available, but you have to know how to look for it. Mm-hmm. If it's federally sponsored, like CDC or NIH. We've got to support these places, make sure that their information is accessible to the general public, and then I think it all gets down to education. Mm-hmm. We've got to educate our children and our population that what is evidence and how do you find it, and support those types of programs.
And even just with working on health policies, whether within New York City or in the state, did you have to work with lawmakers and politicians in order to get that done? And do you think just seeing health policy evolve over the decades, do you think that's harder for people to, in terms of talking with lawmakers today and politicians today compared to even the 80s or 90s?
Yeah, I think so. We've really seen a shift, and I at the moment, and I do believe that that there's sort of a pendulum effect of history and social change, and that you go one way and then kind of go back another way, and then you go back, and I think we're going backwards a bit right now in terms of moving, a political agenda that would increase the health of the population. It was exciting at the time when I was involved because this whole concept of evidence-based medicine was supported both federally and politically, whereas at the moment, and so politicians wanted the evidence, and we got invited to come to hearings, to congressional hearings, and present, say, our cost effectiveness work, and now I think the scientists feel more under attack and not supported. So I think it's quite different.
Definitely. And then I wanted to switch it a bit to the North Fork, and when did you first discover the North Fork?
I discovered it the weekend we moved. I moved from Washington. A very good friend had a party to welcome us to the North Fork. She lived in East Marion. And at that party, I actually met a colleague that I would get to know pretty well at Mount Sinai. It was a lot of fun, but so that was day one, really. I then had a chance, a couple days, to explore Orient and Greenport and East Marion, and just was astonished at how beautiful it was. I was coming from Washington, D.C., and there, to get to the ocean, you drive over 3 hours in heavy traffic, and then you get to a beach, Rehoboth, that is lined with, apartment buildings or condos or hotels or whatever. A lot of concrete right up against the sand. And when I got to Orient and discovered Halleck's Bay, I was astounded at the beauty, and there was nobody there. I just really could not believe it. I was 2 hours from New York City, and there was nobody on this beautiful bay. And I thought, this is it. My wife is an architect and a gardener, and it was hard to get her to move to New York, but I had to promise that we could see trees, and so this just seemed, and I love the sea, so this seemed perfect. There was fertile land, farming everywhere, and the sea surrounded us. So, and that was a time when things were happening too. I think Reagan was the president, and land was being sold. It was the beginning, I think, of selling some of these farms. And I know there's, we don't like to lose the farms, but at that time it was an old Latham farm that had been subdivided, but the lots had not been sold yet. And we were actually the first buyer of this subdivision that Peter Blank had married a Latham woman, had put together. And we always kicked ourselves that we didn't get 2 lots, because immediately it was like dominoes. They all fell. And by the time the last one sold, it was like for at least 3 times as much as we paid.
Okay. So you definitely saw some of Well, you saw it when it was initially starting to change.
Yeah.
At that point.
Yeah, we were part of that development, and I know we have mixed feelings about it. We were lucky to be here, but then what happened is we learned, and 23 acres between us and Halleck's Bay came for sale, and we didn't want what happened in the lots that we were in, which was called Kings Bay Development, to happen again. We were so lucky we got a parcel, but it was wrong to carve up the land like that, and so we bought that 23 acres. So put together a group that we were not wealthy people. Architects and professors are not wealthy, but so we put together a sort of a group that was able to get a mortgage on the land and then do some spec houses to pay back the mortgage. Mm-hmm. And so we divided the land into 4 5-acre lots. Very different. I mean, it was, a third of what could have been in terms of development. So we do feel we saved that land. And the first house, we hit ground, the shovel hit the ground, and it was Black Friday. And the market, everything crashed for a while. We were just scared to death. But we kept going. We had to. And Willard Roosevelt bought that house. His wife fell in love with it. And this was the grandson of Teddy Roosevelt. So, wow. So the market fluctuations didn't bother him so much. And we were able to get out and sell 2 houses, and then just sold the land for the other 2 lots. But the Pocatuck Lane is still there, and the lots cannot be subdivided.
Okay. And I was curious if you what you thought even of Greenport at that time, because that was going through changes too.
Absolutely, it was a struggling fishing community, and I loved that. I loved some of the, we would loved coming in for some chowder, and we had a number of favorite places in Greenport, and I loved the harbor. And it's been amazing to watch it change. I mean, it's a lot of the houses were run down. They're no longer run down. They've been fixed up, painted, renovated. So it also has gone through a huge change. But I've loved every phase, really.
Yes.
Aldo's was there. We got to know Aldo. And,
yeah.
And Preston's. Preston's was one of my favorite places in the world.
Yes, yeah. Definitely. And then, so when did you start getting involved in the community, whether with some of the organizations like the North Fork Audubon Society or Oysterponds Historical Society?
Well, that's relatively recent.
Okay.
I was pretty much a commuter. I mean, we've been here for over 40 years, but a lot of that was on weekends. And then actually when the pandemic hit, we moved out full time. Okay. And so being here full time is what changed everything. I mean, up until then, I was really working 60, 80 hours a week, really. It's a very competitive field. And so I needed something to do. I was retired, and I was just invited to join these organizations, which I'm thrilled about. I'm so happy to be that and change my focus from, health policy at a national level to community service, and with Audubon, I've always thought I've changed my passion for creating a healthier environment for people, for animals now, for birds, for nature.
Definitely. And then, in addition to your health policy work, you're also a musician. You play in the local string band, the Mudflats. How did you get involved with that group?
Well, I founded the Mudflats.
Okay, sorry.
and that happened through a passion that I kept up all through the career demands, barely. But I just loved playing the violin. I did take lessons as a child. In the fourth grade, they did a hearing test of all us fourth graders in public school, and two of us were called out and given violins, and then the rest were given sort of horn instruments or other instruments. So I guess I have a pretty good ear. And then I took lessons for a while, but then I stopped much too soon. And then I really missed it, particularly in graduate school. And I promised myself once I finished my dissertation, I would go back to it. So I took some lessons at the 92nd Street Y. And had an incredible teacher, Isaac Zaslavsky, who had been first violinist at what was then the St. Petersburg Symphony, now the Leningrad. But I realized I was playing like an elementary school student, playing these beautiful pieces, Mozart, sonatas, and I thought maybe if I did something different. I bumped into a book called Blues Fiddle, and it turns out that the woman who wrote it was in New York. I took lessons with her, and she introduced me to this whole world of fiddle music that I just absolutely fell in love with. And the place that has just a wonderful repertoire and teaches people is called a shokin. I mean, actually on that board also, run by a man named Jay Unger, who wrote A Shokin Farewell, which was taken up by Ken Burns in the Civil War series. It's a long answer to the band, but just the fiddle music. He has these different weeks in a Southern week. I just fell in love with this Southern Appalachian style of fiddle music. And it's a happy style. It's heartrending. And it's joyous and lively and, mournful. And it just brings out all these emotions that there are no words for. You just feel. And I just wanted to play that. So I worked on it, and we started a little band. We were terrible. And but also at the same time, Gideon D'Arcangelo, Gideon, that's his word, started the Song Swap, the Orient Song Swap. And so we had our first performance, and people loved it. I mean, we were really bad, but it's the music that carries it. It's the energy of the music. And these are, 1,000-year-old or certainly hundreds of year old tunes that came over from England and Scotland and Ireland. And so the tunes are kind of in our epigenetics, in our blood, so to speak. So you can play them badly and still get away with it. People liked it. And then slowly, as we were playing around the neighborhood, and a couple of professional musicians that are friends showed some interest. And so we invited them to join the band. And for a long time, we could only announce us as we're the Mudflats with special guest artists, Helen Hook and Nancy Baxter. And slowly we got better. They taught us, and they played with us, and we sounded better. And slowly they allowed themselves to be part of the band. And that's been for maybe even 5 years now. So that's the Mudflats.
And you've been able to branch out and play at a wide range of places, whether throughout the North Fork.
Throughout the North Fork, not further than that. Well, actually, we've been in this traditional, just American music festival in Sag Harbor, and that's been nice. We were invited back for that. That was fun. But I'm very excited this year. We're going to play in the Southold Showcase Concert Series. And then our next gig, actually in a week and a half, is at the Jamesport Meeting House. So we're going west a little bit. still the North Fork.
Wonderful.
Yeah.
And then I think I had maybe just two other questions. Sure. More so because you've been coming out here for at least 40 years or more. But what have you enjoyed the most about living out here on the North Fork? It's a broad question.
Yeah. Well, I mean, I love the community. I love the people. We seem to have a sense of place that we all love and admire and want to, sustain. And I think that, the combination of the sea and the land, so both being used so fully. I love clamming. I love fishing. I love oysters, and the oyster. Now the Oysterponds Shellfish Company has started, and that's wonderful. So and then the farmers have started with the CSAs. They've started, and I think that the quality has just been improving almost constantly. So I love that. I love that energy of really, really protecting and being fulfilled by the environment.
Yes. And then just looking ahead, what are your hopes for the future of the North Fork and its community down the line? What would you hope to see?
Well, I think affordable housing is a huge crisis.
Yes.
But I would hope to see that we keep a mixed community of economically mixed, socially mixed, racially mixed, age mixed. I would hate for us to become a gated community, or a community only. I think my horror would be that we would be the Hamptons, and I hope we can avoid that.
Yes, definitely. No, and then just lastly, I'd just like to ask if there was any other things you'd like to mention or discuss that we haven't talked about or touched on.
I think your questions have been wonderful. I can't think of other things that I would add. I think how long has it been? Probably long enough, right?
Oh, yeah. No, definitely. But I want to thank you for taking the time to come on the podcast today and share your story and the work you've done in the medical field, as well as your continued involvement in the community on the North Fork. So thank you so much.
Thank you. It's been a pleasure.
Well, I hope you enjoyed episode 132 with Mimi Fahs. I want to thank you for listening to the Floyd Memorial Library podcast, and we'll see you next time.